Yes. The process of assessment, assessing patient is very critical in the formulation of good, best interventions for a patient. When a patient comes to your clinic, the first thing you do is to thoroughly assess the patient. Why are you assessing the patient? You are assessing the patient to know exactly the thing that the patient is presenting with, the patient problems, so that you can address it. Every patient problem is unique. That's why it's good to do assessment. So when you conduct a thorough assessment of a particular patient, you'll be able to itemize the patient's problems, the challenges, so that you'll be able to know the best form of intervention to give that particular patient. So treatment of every patient is individualistic. It is based on the individual. No two patients have exactly the same um, the same problems. The problems may be broad, but by the time you atomize, you sit down and do a proper assessment, you discover that there are some peculiarities of every patient. Let's assume you have 10 stroke patients for rehabilitation. They came to your clinic as a physiotherapist for rehabilitation. They all have stroke. But by the time you sit down and assess each of them, especially draw your physical diagnosis based on ICF model, that is International Classification of Diseases, Disability and Functioning, you'll be able to understand that all of them don't have exactly the same challenges. Some have one, they may have issues related to different domains of the ICF model. So thorough assessment, as you can see me, I'm trying to go through a case folder of a patient that we recently assessed. So to be able to know exactly what and what you can do for the patient. So if you're a clinician, assessment is very, very important. If you miss the assessment, you will miss the treatment. Because if there's wrong assessment, then there will be wrong diagnosis, then there will be wrong treatment. So assessment is very, very fundamental to the treatment and recovery of every patient.